Have you ever wondered if the medication sitting in your medicine cabinet could actually be putting your health at risk? If you're over the age of 60, this is something you simply can't afford to ignore. Millions of older adults take several medications every day for conditions like high blood pressure, diabetes, arthritis, heart disease, and high cholesterol. While each medication may be safe when taken correctly, combining certain medicines can lead to dangerous side effects that many people never see coming. Some medication combinations can silently increase the risk of internal bleeding, kidney damage, severe dizziness, dangerous drops in blood pressure, confusion, falls, and even life threatening heart problems. The most concerning part is that many seniors unknowingly take these combinations every single day. Today's video is not meant to scare you, it's meant to help you stay informed and protect your health. We'll reveal 7 medication combinations that seniors should never mix without medical advice. Knowing these risks could help you avoid serious complications and even save your life. Before we begin, remember that this video is for educational purposes only. Never stop or change any prescribed medication without first talking to your doctor or pharmacist. Make sure you stay until the end because the final medication combination is one of the most common mistakes seniors make, and very few people realize how dangerous it can be. Now, let's get started with the first medication combination. Let's begin with one of the most dangerous medication combinations for older adults: blood thinners and common pain relievers. Many seniors take blood thinning medications to reduce the risk of blood clots, stroke, or heart attack. These medicines can be life saving when used correctly. At the same time, it's also common for older adults to take pain relievers for arthritis, back pain, knee pain, or headaches. Since these pain medicines are often available over the counter, many people assume they're completely safe. Unfortunately, that's not always true. When certain pain relievers are combined with blood thinners, the risk of internal bleeding can increase dramatically. This bleeding may occur in the stomach or intestines, and in some cases, it can become life-threatening before any obvious symptoms appear. Early warning signs may include unusual bruising, bleeding gums, frequent nosebleeds, black or tarry stools, vomiting blood, severe stomach pain, dizziness, weakness, or feeling unusually tired. Some people ignore these symptoms because they believe they're simply part of getting older. However, these could be signs of a serious medical emergency. The danger is even greater because internal bleeding doesn't always cause pain. It can develop slowly over several days or even weeks, making it difficult to recognize until significant blood loss has already occurred. Another common mistake is taking more than one pain reliever at the same time. Some cold and flu medicines also contain pain-relieving ingredients, which means you could accidentally take a higher dose than intended without realizing it. The safest approach is simple. If you're taking a blood thinner, never start a new pain medication, even an over-the-counter one, without first asking your doctor or pharmacist. A quick conversation with your healthcare provider could prevent a serious complication. Remember, just because a medication is sold without a prescription doesn't mean it's safe for everyone. Your age, medical history, and the medicines you already take all play an important role in determining what's safe for you. Now that we've covered the first dangerous combination, let's move on to another common mistake that increases the risk of falls and memory problems in older adults. Now let's talk about another medication combination that many seniors take without realizing the risks: sleeping pills and allergy medicines. As we age, getting a good night's sleep can become more difficult. Many older adults use sleeping pills to help them fall asleep, while others take allergy medications to relieve sneezing, itching, or a runny nose. On their own, these medicines may be appropriate when used correctly. However, taking them together can create serious problems. Both sleeping pills and many allergy medicines can slow down the central nervous system. When combined, their effects become even stronger. Instead of simply feeling sleepy, you may experience extreme drowsiness, confusion, poor balance, slower reaction times, and difficulty concentrating. For seniors, this can be especially dangerous. A simple trip to the bathroom during the night could result in a fall. Falls are one of the leading causes of broken hips, head injuries, and hospital admissions among older adults. Recovery from these injuries can take months, and in some cases, people never regain their previous level of independence. Another concern is memory. Some seniors notice increased forgetfulness or confusion after regularly combining these medications. Family members may think these changes are simply due to aging, when in reality, the medications may be contributing to the problem. Warning signs include feeling unusually sleepy during the day, having trouble remembering conversations, feeling dizzy when standing up, or stumbling while walking. These symptoms should never be ignored. If you rely on sleeping pills or allergy medicine, talk to your doctor or pharmacist about safer options. Sometimes adjusting the dose, changing the timing, or choosing a different medication can greatly reduce the risk while still providing relief. Remember, medications that seem harmless can become dangerous when combined. Always check with a healthcare professional before taking new medicines, even if they're available without a prescription. Now, let's move on to the third dangerous medication combination that could silently affect your heart and overall health. Now, let's discuss another medication combination that often surprises seniors: blood pressure medicine and potassium supplements. High blood pressure is one of the most common health conditions among adults over 60. Millions of people take medication every day to keep their blood pressure under control and reduce the risk of heart attacks and strokes. These medicines can be extremely effective when used as directed. However, some blood pressure medications can also increase the amount of potassium in your body. Potassium is an essential mineral that helps your muscles, nerves, and heart function properly. But while your body needs potassium, too much of it can become dangerous. Many seniors believe that taking extra potassium supplements or drinking electrolyte beverages every day is always beneficial. Unfortunately, combining these with certain blood pressure medications may cause potassium levels to rise to unsafe levels. One of the biggest dangers is that high potassium often develops silently. You may not notice any symptoms until the levels become dangerously high. When symptoms do appear, they may include muscle weakness, unusual fatigue, tingling sensations, nausea, an irregular heartbeat, chest discomfort, or shortness of breath. In severe cases, very high potassium levels can interfere with your heart's normal rhythm, creating a potentially life-threatening emergency that requires immediate medical attention. The good news is that this risk can often be prevented. If you're taking blood pressure medication, never start potassium supplements unless your doctor specifically recommends them. Your healthcare provider may also order routine blood tests to monitor your potassium levels and ensure they remain within a safe range. It's also important to remember that many salt substitutes contain large amounts of potassium. If you've switched from regular table salt to a salt substitute, mention it to your doctor or pharmacist. Something that seems like a healthy choice could unexpectedly increase your potassium intake. Protecting your heart isn't just about taking the right medication. It's also about avoiding combinations that can do more harm than good. Now let's move on to the fourth dangerous medication combination, one that can cause blood sugar to drop suddenly and unexpectedly in seniors with diabetes. Now let's look at another medication combination that many seniors underestimate: diabetes medication and alcohol. If you have diabetes, you already know how important it is to keep your blood sugar under control. Many older adults take diabetes medications every day to help maintain healthy blood sugar levels and prevent serious complications. These medicines can be very effective, but when alcohol is added, the situation can quickly become dangerous. Alcohol can interfere with the way your body regulates blood sugar. When combined with certain diabetes medications, it may cause your blood sugar to drop suddenly, sometimes several hours after you've had a drink. This condition, known as hypoglycemia, can become a medical emergency if it's not recognized and treated quickly. The first signs of low blood sugar are often easy to miss. You may begin to feel shaky, sweaty, hungry, dizzy, weak, or unusually tired. Some people experience blurred vision, headaches, or difficulty concentrating. As blood sugar continues to fall, confusion may develop, making it difficult to think clearly or respond appropriately. In severe cases, a person may lose consciousness, have a seizure, or require emergency medical treatment. These situations can be life-threatening if help is not available immediately. One reason this combination is especially dangerous is that the symptoms of low blood sugar can look very similar to the effects of alcohol. Friends or family members may assume someone is simply intoxicated when, in reality, they're experiencing a serious medical emergency. The risk becomes even greater if alcohol is consumed on an empty stomach or after skipping a meal. Without enough food in your system, your body has a harder time maintaining stable blood sugar levels. If you have diabetes, talk to your doctor about whether alcohol is safe for you and how much, if any, is appropriate. If you choose to drink, never do so on an empty stomach. Eat a balanced meal, monitor your blood sugar as recommended, and always follow your healthcare provider's advice. Remember, protecting your health isn't just about taking the right medication. It's also about understanding how everyday habits, including alcohol consumption, can affect the way those medications work. Coming up next, we'll discuss another surprisingly common medication combination that can silently damage your muscles, liver, and overall health if you're not careful.